So if you ask who is better, grandfather or grandson, each one is special in their own way. So allopathy is not a single system of medicine. This modern scientific system has roots from all the traditional medicine. Now there is only one term which is called evidence-based medicine. Hello friends, welcome to your YouTube channel. Amidst this raging pandemic which is engulfing thousands of lives daily in our country, one unpleasant discussion is going on which is totally unwanted in this situation. What is that? Which is best, allopathy or Ayurveda? One yogi guru is accusing the allopathy doctors, then again the IMA, the organization, is coming back with defamation notice, then the health minister intervenes, and all unpleasant discussion is going on, and the yogi guru, one organization, is posing some 25 questions. So please answer this 25 questions like essay on 2-mark question. Please answer all this. What is this all about? So thousands of people are dying every day. So all the medical community, irrespective of the system of medicine, we should all strive hard to save at least one life daily. So that is what it is all about. It is not the time to fight which is best, allopathy or Ayurveda. And I would say this discussion has been going on since ages, and this very discussion is totally meaningless. So that is what we are going to discuss about in detail, but in a lighter note today. So if one asks which is best, doctor, allopathy or Ayurveda, the question has no meaning. Say if you ask in a family, grandfather is there, grandson is there. Grandfather brought up in olden ages, but he is having lots of wisdom, lots of knowledge, lots of experience in managing practical tough situations. Grandson brought up in modern era, and he knows lots about gadgets, he knows about the technical things, and maybe in tough situations he might break down, he might need the help of grandfather. So if you ask who is better, grandfather or grandson, each one is special in their own way. All the wisdom that the grandfather has inherited, only if it is passed on to the grandson, then the grandson can develop into a more mature person, but at the same time with all the technical advancements. So the entire discussion of whether Ayurveda or allopathy is best is just like comparing in a family whether grandfather or grandson is best. The total discussion is meaningless. See, 100 years back, if you want to go from one place to another, how we used to travel, either using bullock carts, horse carts, something like that. Then lots of scientific advancements came as time went by, but one should not say that okay, the old bullock cart and horse cart had wheels, that is the base. Even if you have a V12 turbocharged car, if you remove all the wheels thinking that okay, it is from olden days, then how will the car move? So allopathy is not a single system of medicine. So everyone is totally misinformed. There is no single country that can claim okay, allopathy is ours. It is like Ayurveda belonging to India, homeopathy belonging to Germany, Unani belonging to some Persian countries. This modern scientific system has roots from all the traditional medicine. Say I will tell few examples. You know, we are all using aspirin for all the cardiac problems, for painkiller, for many purposes we use aspirin. Aspirin is nothing but a derivative of oil of wintergreen. Even from the Greek olden days, 400 BC, it was known that this oil of wintergreen was very useful in relieving all the joint pain and all any fever and something like that. Using this ancient wisdom, some person in 1700 or 1800 extracted the compound, that is methyl salicylic acid, then acetyl salicylic acid, which is called aspirin. So this is how most of the drugs have evolved. DIGOXIN came from Digitalis purpurea, that is foxglove, very common plant. Then the treatment for malaria, the quinine, came from cinchona leaves. Then the artesunate came from artemisinin derivatives. The modern cancer drugs, vincristine, vinblastine, they came from Africa, predominantly from a plant called Madagascar periwinkle. The common diabetic drug everyone uses, metformin, which has come from French lilac, have some roots in traditional medicine. Even all the majority of the antibiotics we use, majority are derived from fungus, which are just natural sources. So modern medicine is not something derived directly from factories or from outer planets. It is just the ancient wisdom is being used with additional technology. It is just like adding an engine to the bullock cart. The wheel is the base. So you should not see it something as an alien. So, but at the same time, you should not neglect the age-old wisdom also, because that is where our roots came from. So neglecting this traditional medicine is also bad, but at the same time vilifying the modern scientific medicine as something derived from Western, English medicine, then European medicine, it is bad. Now there is only one term which is called evidence-based medicine. So what is evidence-based medicine? If a diabetic person wants to take a drug for diabetes, he wants to know only few things, whether the drug works. You can't say the drug has derived from Himalayan mountains, no use. You can't say we made it in a state-of-art factory in Germany, no use. He all wants to know whether it reduces blood sugar levels, as simple as that, and whether the side effects are minimal, and whether the effect lasts longer, and whether it prevents other complications of diabetes also. That is all he wants to know. How a medicine can be proven whether it works or not. So you have to do something called clinical trials. So what is a clinical trial? So this is the base of all this evidence-based medicine. It is not only for allopathy, every other medicine can use this clinical trial method of evaluating the effectiveness and adverse effects of a drug. So what is that? So say for the same example we will take, if it is for diabetes. So for the diabetes, you take 100 people, and if you want to know whether one particular tablet or injection or one herb or Ayurveda or Siddha or acupuncture, something works. So what you will do, from the 100 people, you divide into two groups, 50 people in this group, 50 people in another group. Then for 50 people, you give this whatever medicine or tablet or herb or something like that. And another 50 people, either you don't give anything, or you can give something called placebo, which are just some sugar pills or something like that, or you can use one already existing drug which is proven to be useful in diabetes. So you compare both the groups, you see how much reduction in sugar is there in this group A versus group B, and how are the adverse effects or side effects in both groups. So if you compare all this, how is the effectiveness? Are there any other problems? Does it help only in reducing blood sugar? Are there any unwanted effects? Does it reduce any other complications also? You study all these. Only then we will be able to find, okay, so this drug or this treatment method or this diet or whatever be it, whatever intervention we have done in this group A, whether it is effective or not, it can be found only by comparing with another group with either a placebo, that is no drug, or with already an existing drug. This is called a clinical trial. Only by doing proper clinical trials in this era, we will be able to find the actual effectiveness and the adverse effect profile of a drug. So how are clinical trials being made nowadays? So if any drug or medicine or herb is thought to be effective for a particular condition, what they do is something called in vitro studies. So they use some culture plates, some cell culture, without giving to people, they use some cell lines and they do with microscope and all the chemical analysis. Then they do something called animal studies, they give it to animals, guinea pigs and all that, then they will see the effectiveness. Then starts the human trials. First they will, the phase 1, phase 2, phase 3, first they will give to healthy volunteers, then they will give to a limited number of diseased people, then they will give to a large number. Only by doing the study on some 20-30 people, you can't prove the effectiveness. You have to give it to a little bit larger population, 200, 300, 500, depending upon the disease. Then only after the phase 3 clinical trials are completed, by comparing both the groups, only then we can ascertain the effectiveness and the adverse effect profile of a drug. Only after that an approval for a particular drug will be given. Why this evidence-based medicine is the need of the hour? See, in this coronavirus pandemic, right from the January 2020, lots of regimens and lots of drugs from various systems of medicine have been thought to cure coronavirus. So initially they told, from the modern medicine, they told, Donald Trump told, when you combine HCQS with azithromycin, corona will go away. But it didn't go away. We were using HCQS and azithromycin. Only when the World Health Organization did the solidarity trial, we were able to find the redundancies in drug regimens. We found that the HCQS is not useful. We found azithromycin is not useful. We found that all these HIV drugs, ritonavir, lopinavir, they are not useful. Remdesivir is useful in a particular group of patients, not for everyone. So how do you find it? So the same mouths which said that okay, these drugs are very, very effective 1 year back, now we are saying we don't use it, only because we are doing studies and we are finding which works and which doesn't. So this is the same method that has to be followed in every system of medicine. Only when every system of medicine embraces this evidence-based method, all the patients will be beneficial. Many questions that were asked in the 25 question note were meaningless. So there were some lines about type 1 diabetes. Even the ancient textbooks of Ayurveda such as Charaka Samhita and Sushruta Samhita have notes about type 1 diabetes. They have told that it is called Sahaja Premaha or Jata Premaha. They will be very lean, and after diagnosis of diabetes usually they will die off within a matter of few months. Even the ancient classical Ayurvedic textbooks have not given any treatment for type 1 diabetes. Only after discovery of insulin, type 1 diabetics people are alive after diagnosis. We should know that. We should not make any unscientific claims that we can cure type 1 diabetes. Even the old Ayurvedic books haven't said that. But at the same time, lots of randomized controlled trials are being conducted by many Ayurvedic colleges and Siddha institutes right now. I came across many trials. Only after doing trials, we will be able to find whether it works or not. I saw a lot of trials for this rheumatoid arthritis. They have shown that it is equally effective as methotrexate for rheumatoid arthritis, which is excellent to know. But at the same time, there are some negative trials also. They compared yoga versus Ayurveda for treatment of myopia, that is glasses in children. They found that either yoga or even the Ayurvedic drugs, they do not reduce the refractive power. Only when we find that out, we will be able to elevate this to a higher level, and with this lots of wisdom in this in ancient medicine, lots of wisdom in this traditional medicine, we can gift thousands of useful treatment to the entire world. So that can be done only if we embrace this evidence-based concept. So both the groups should shun all their differences. All the modern medicine practitioners should stop saying, okay, all this Ayurveda is some pseudoscience. No, but at the same time, all the traditional medicine should stop villainizing allopathy, villainizing the modern medicine drugs. It is useless. There is no use. A grandfather will not villainize a grandson just because he is modern. It is the same tradition, same roots. So instead of villainizing, one has to learn some concepts from the modern medicine. They have to adapt the evidence-based medicine and give evidence for all the treatment. Only then both the medicines can work together, or it is just a family, just like grandson and grandfather. Both can work together to improve the quality of life and improve the health of crores and crores of people worldwide.